Hello, this is Dr. Gay from First Look MRI, and this is a 42-year-old female who complained of left eye visual disturbance. She also had some headaches and left-sided tinnitus, so she went to her ophthalmologist to get her eyes checked out from the vision loss or disturbance on the left, and they found out that her left pupil would not dilate. And when someone has a non-dilating pupil, they think of a disease called Horner's syndrome, or a syndrome called Horner syndrome, and that is a problem with the sympathetic chain. It can be in the head, neck, or chest. People with lung cancers, Pancoast tumors at the top of the lung sometimes will have this, where they have a disturbance of the sympathetic chain. And they said she needed to go get some more imaging, but first see the neurologist. And the neurology consult was set up, but it was going to be for between 6 and 9 months. So she did not want to wait for all that time. And of course, nervous about the possibilities it could cause a Horner syndrome. So she decided to come in and just start with her brain and see if we found something there and maybe move on if necessary. So here she is with her MRI of the brain, and we note that her brain looks very, very good. This is her brain stem. Her pituitary gland is right here. But if we step one direction, this is off towards the left, we see a dark area right in the cella, right touching the pituitary gland, which is not normal. And on this view, we see the left internal carotid artery looping around, and there's this other structure. It looks like it may be a blood vessel coming off of the carotid artery. So we're going to look at that better on another view. We'll go to the axial images. Now in this axial sequence, we can see the eyes here. This is the right eye, left eye, they look normal. Sometimes people with Horner syndrome can have a sunken eye, but hers looked good. And she did not have any droopy eye. Horner syndrome can have a droopy eye. Ptosis, you can have anhidrosis, the lack of sweating on the side, and the myosis, which is the pupil non-dilating. She only had one of those three complaints, which was the non-dilating pupil. So her eyes look good on this. And as we go back here to look at that carotid again, we'll zoom on up. And on this view, we see the abnormality. We see this aberrant vessel here. This is a persistent anastomosis between her basilar artery back here and her left cavernous carotid artery over here. So this is the cavernous carotid artery, basilar artery, and this is a persistent vessel called the persistent trigeminal artery. Normally, in utero, this will involute, but in a very small percentage of people, like 0.1 to 0.6%, this won't involute. It'll persist into adulthood like this, and often this is just asymptomatic. We find it when we do an angiogram. We see this aberrant vessel as an incidental aside. But in this case, she is having left-sided symptoms, and so we assume this is leading to her miosis or lack of pupillary dilatation. Now, one other thing, this is her carotid artery. It's too long and elongated. This is the right side, and this is the left side. So this is loops here forward in the cavernous sinus, and the third nerve, the oculomotor nerve that makes the pupil constrict, is over here in the cavernous sinus. So it's possible that there's a problem with that third cranial nerve, or possibly related to something at the sympathetic chain that's causing this. But this is, again, a persistent trigeminal artery. It's on the left, and it's associated with a prominent left cavernous carotid artery, or a looped one here that goes too far forward. And this may be resulting in her left-sided myosis. And that's it. Thank you so much.